Hey, hi everyone. How is everyone doing today? Here again is Upstream Health with Ify. So today we're gonna be talking about this topic, which I know we don't always want to talk about, and I know you might feel it strange or awkward that I, as a female, is discussing this with you. So I truly understand, but as a healthcare professional, I have some important information that you might need to make your decision concerning this issue. So this condition is known as erectile dysfunction. Some people call it impotence, low libido. So I'm gonna be making it simple. Let's put it as ED. When you hear me say ED, erectile dysfunction, okay? So erectile dysfunction. So this is a topic or an issue that most people find it very, very uncomfortable to discuss with your primary care provider. So here it's free for you. You're just gonna pick up your phone in the comfort of your room. You're gonna listen, you're gonna watch, you're gonna understand, learn some basic information that will allow you or enable you make further decision, like what you want to do based on treatment. Okay, so I'm not going to be talking about a lot of treatment. Like if you need a more comprehensive workup or treatment, I'll advise you follow up with a urologist. I'm not a urologist, but I am a nurse practitioner, and I can give you basic information that you will need in understanding what erectile dysfunction or ED means and what you can do. I'm also going to be talking to you about some lifestyle changes, some things you can do to improve your libido, some things you can do based on diet also to manage, I don't want to use the word manage, to take care of erectile dysfunction. So doing this alone can also work, but when it gets so complicated, complex, because you don't know other underlying factors, that's why I said you try all those options that I'm gonna give you. If it's not working, it means you need a more comprehensive workup where they're gonna do a blood work, some tests, or the doctor might decide the kind of oral medication you might need, or even surgery for penile implants or removing a blockage. So remember, I want you to listen to me step by step. Don't miss any of the thing I'm going to do, because believe me, you are going to be assessing yourself and even almost diagnosing yourself to know what the problem is and what the option that you can take. Okay, so what is ED? What is erectile dysfunction? What is low libido? What is impotence, or as you understand it? So erectile dysfunction is when the penis is not able to sustain erection long enough to achieve sexual pleasure or sexual performance. So that's what is called erectile dysfunction. When the penis is not able to sustain that muscular rigidity during sexual activity. And the next question is, what causes erectile dysfunction? There are so many causes of erectile dysfunction. I'm going to group it into organic and then psychogenic. So let's start with organic causes of erectile dysfunction. One, it can be vascular, which is a huge one. I'm going to talk about that later. Vascular, which means, remember when we talked about when we talked about high blood pressure, I did discuss with you guys how the pressure in the vessels in the artery or in the blood vessels gets above a certain number when the heart is contracting and relaxing. So high blood pressure, remember when the blood is flowing through the vessels, right? So the same mechanism of vascular activity in the arteries of the heart or the carotid arteries of the brain is the same mechanism going on in the penis. The penis has an artery that moves blood down to the penis. So during erection, blood is supposed to flow so quick down to the penis, relaxing the muscle and giving the penis that muscular rigidity and helping it to sustain it while sexual activity is going on. So if there's anything that affects the artery or the vascular function of the penis, that's where you have erectile dysfunction. So keep that in mind. Vascular, okay? Number two, we also have hormonal. So hormonal has to think about the hormones involved in the sexual characteristics of man, right? So the major one here is testosterone. Testosterone is a major hormone involved in erectile dysfunction. So I want you to keep that in mind. We talked about vascular, we talked about hormonal. So anything affecting the testosterone, maybe a man has low levels of testosterone, can be a cause of erectile dysfunction. So remember, vascular, anything affecting the vasculature of the penis can affect can cause erectile dysfunction. Number three, let's talk about chronic medical conditions. So chronic medical conditions like people with diabetes, people with high blood pressure, people with cholesterol issues, people with cardiovascular diseases. So this third one is a little bit similar to vascular. So remember when we talked about metabolic syndrome, insulin resistance being related to diabetes, cholesterol, hypertension. So when you have all those issues, remember metabolic syndrome, overweight, cholesterol, all those issues are related to erectile dysfunctions. So chronic conditions. Then the fourth one is, let's talk about penile injury, like when you have trauma to the penis, maybe during accidents, it can cause erectile dysfunction. We have also neurogenic. So neurogenic is when the nerves are involved, like when the message coming from the brain, you know, when you get the sexual arousal, messages should be coming from the brain down to the penis to send the activities or the chemical reaction to cause erection. When a nerve is affected, let's say stroke is a type of neurogenic condition that can affect sexual activity or cause erectile dysfunction. And the other one is medications. The medication is another source or risk factor or cause of erectile dysfunction. Some medications, so if you notice you just started on medications, or you notice that when the erectile dysfunction started was when you started some medications, then that's a clue. So check if you have these medications, if you're on high blood pressure medications like thiazides, you know, hydrochlorothiazide, if you have those medications sounding like thiazide, if you have beta blocker, the ones ending in law like metoprolol, propanolol, if you are on, okay, those who are treating prostate cancer, some medications for treating prostate cancer can also cause erectile dysfunction. And we have medications for treating depression. Some antidepressants also can cause erectile dysfunction. Okay, so another one is psychogenic causes of erectile dysfunction. So I can say an example of that is, of course, anxiety. That's when people say performance anxiety. And I know there's this myth when people talk about erectile dysfunction, they'll be like, oh, the cause is majorly performance anxiety. It's not performance anxiety. Performance anxiety is just one, just a little bit percentage of performance anxiety can cause erectile dysfunction. And the individuals affected don't have this always. So it could be because you're meeting someone for the first time, or you're about to do it for the first time. So that's performance anxiety. Another example of psychogenic, like I said, is relationship issues. There are men who get turned off by appearance of the female. That's an example, and that is just temporary. That doesn't happen all the time. If it keeps happening all the time, then it's not psychogenic. It might be something more organic, like vascular or hormonal. Okay, and if you're treating anxiety, depression, those medications can cause erectile dysfunction. And other causes are like lifestyle habits. Number one is smoking. Smoking is a major cause of erectile dysfunction. Alcohol, heavy alcohol intake is a heavy cause of erectile dysfunction. And here we're gonna go back on vascular. The two major ones I'm going to be speaking here is vascular and hormonal. Okay, so I hope you followed me down to this point, so you're able to assess yourself and see where you find yourself. Is it vascular, which most people are going to fall in the group of vascular? Remember when I talked about vascular, something is affecting the arteries of the penis. It could be plaquing, like a lot of cholesterol deposit in the artery, just like when you hear about someone having a stroke or heart attack, plaquing, clots, like in the carotid artery, in the coronary artery of the heart. When there's plaquing, there's blockage for the heart, they have a stroke. When there's plaquing, blockage, or the plaques break off, it causes a what? A stroke. So with the penis in the artery, if there's plaquing, there might be a blockage. That's one of the examples of vascular causes. So if there's a vascular maybe blockage, it means you need a more comprehensive workup with a urologist. But if it's just a minor let's say a minor constriction, or maybe the arteries are not dilating properly because of other insufficiencies in chemical balance, then there are other things that you can do, which I'm going to be discussing here also. So vascular, have that in mind. Going back again to vascular, so think about how metabolic syndrome, right, is related to cardiovascular diseases. Think about so each time I say metabolic syndrome, I hope you're thinking about